Two.
So the second common area that we can use toxin is the frontalis muscle. Frontalis muscle is responsible for raising the eyebrow. You want to be mindful in assessing the patient because if their eyebrow is sitting very low or they have a hooded eye, you do not want to over inject the lower part of the frontalis muscle because then that's going to make their eyebrow or the eye much heavier. Usually for frontalis muscle, we can use between 15, 20, or for guys, we can use up to 30 units of toxin. Usually the results should last about 3 to 4 months. The third common area is the crow's feet, the muscle around the eye. It's a round circle sphincter. So orbicularis alkali muscle, it's exactly as you guys see. We inject about 20 units. We can also provide a brow lift by injecting a little bit more like lateral to the brow to relax the muscle and give the patient more like a lateral brow lift. Be mindful with the lower part of the muscle because if we go ahead and inject that, this muscle can get a little bit too relaxed and that can create a droopy lid, and we don't want to do that for our patients. The fourth area, keep in mind the muscles are connected to each other. Bunny line. Bunny line is something that not everybody has them, but because it is connected to the 11 line, patients sometimes from getting this two area relaxed, then they're putting all the pressure on the bunny line. So bunny line requires between 6 to 8 units of Botox or Dysport. Now we're moving on to masseter. Masseter muscle is my favorite because a lot of patients who have TMJ, they have a lot of pain, especially they wake up with a lot of soreness, they can get this area. As you guys can see, this is a really big muscle. That's actually one of the biggest muscle on our face. For masseter, we do about 30 units of toxin on each side. It really depends on the patient anatomy. You do want to palpate when they're clenching, and you can really measure the size of the masseter muscle. This is a very deep muscle. You want to be mindful of the rosarys muscle. The rosarys muscle is responsible for our smile. So when you are assessing your patient, you really want to create a little imaginary line to stay away from the rosarys muscle. Otherwise, you could affect the patient's smile, and you don't want to do that. All right, talking about the muscle around the mouth. This is the orbicularis oris muscle. We also call this the smoker line. Keep in mind, by relaxing this muscle, you can also, one, prevent from having a smoker lines. And these lines can happen from using straw, talking, and sometimes patient gets this area injected with toxin to have a little bit of a lip lift. We also treat the upper and the lower lip. The total can be between 6 or 8 units for upper lip or lower lip. So let's talk about mentalis. Not many people focus on the mentalis muscle. Mentalis muscle is responsible for elevating the chin upward, and it creates all this little dimpling that it creates like an orange looking, more like an orange skin. So you do want to educate your patient. You do want to treat the mentalis muscle because otherwise, long period of time, the upper face going to compensate because the lower face will compensate because the upper face is frozen. So be mindful by injecting 6 or 8 units of toxin, you're going to relax this muscle. Therefore, it's going to help to project this muscle as well. All right, let's talk about depressor angular oris or DAO. This muscle is responsible for pulling the corner of your mouth downward. You do want to inject 3 or thinner units of Botox for patients, especially if the corner of the mouth is going downward, especially if the patient has a very angry or serious look. You do want to educate them. This muscle can work extra strong on some patients. So by relaxing this muscle, you're going to help them to elevate the corner of the mouth to some degree. In some cases, patients also may need a little bit of a filler. Be mindful of the platysma muscle or platysmal band, which is the muscle around the neck. It's also an area that you do want to educate the patient. It really depends how strong the neck muscles are. Other area of treatment can also be the back of the hand if the patient are having excessive sweating. Also, it can be the armpit. A lot of patients also can get Botox for the occipital muscle, temple if they're having migraine headache. Thank you for watching this video. If you have any question, please leave a comment and I look forward for our next video.